And we're getting started right now. And for those of you who are joining us on Facebook and Instagram and Zoom across the world, welcome, and we're so grateful to have you. Now let me make sure everything is happening. Everything is working? Okay, Dr. Zelenko, can you hear me?
I can hear you. Hi, Rabbi Shmuley.
First of all, let me just say what an honor it is to have you. And I think people need to understand and know before we even begin that you are doing this this Facebook Live broadcast from your room in the hospital at Lenox Hill, where tomorrow or Thursday you're undergoing open heart surgery. Is that correct?
That is correct, yeah.
I mean, I can't thank you enough. It's another example of the kind of dedication that you bring to your craft, to your calling as a doctor, that you're prepared to talk to us just before you yourself, that you're going to talk to us about such an important issue about the coronavirus and how we keep people healthy, just before you yourself undergoes such an important and vital operation. So I can't thank you enough. How are you? Before we get to anything else, let's just talk about you. How are you doing? What is if you don't mind me asking, what is the nature of your own surgery and how are you?
So 2 years ago, I was diagnosed with a pulmonary artery sarcoma, a very rare and deadly tumor. And I underwent open heart surgery and lost my right lung, and they had to reconstruct my pulmonary artery. And then ever since then, I was going for surveillance CAT scans. It's been 2.5 years. And then last week, I went for another CAT scan, and unfortunately, they found a mass in my pulmonary artery attached to my pulmonic valve. And so I have to undergo surgery to remove that valve, diseased valve, and replace it with an artificial valve. So it's a very big surgery, especially having one lung. But, Mitzvah Shem, everything will be okay.
Well, you're an incredibly positive person. First, let me say that, of course, all of us are praying for your health and well-being. I'm a little bit in shock hearing this. It's hard for me to process all this because your family and my family recently spent time together in Pennsylvania at our friend Ted's bed and breakfast hotel, the Chelsea Sun Inn, beautiful place. I did my minyanim there, my prayer service at the Quorum of 10, say Kaddish for my late father. You participated, for which I'm so grateful. So we had fascinating conversations and we got to know each other, which is why I wanted you on. And I want to talk about your achievements and how many lives you've saved through the COVID-19 crisis. But for me to now hear this, maybe less than 2 weeks after our families were together, I'm just in shock. Like, how did this happen so rapidly?
I don't have an answer for that, but I'm just in the same shock as you are, believe me. But I believe that everything that God does is good, and I really do believe that. And my life experience, all the difficulties and challenges that I have had to go through, in retrospect, I look back at them and they were really blessings. So I have no doubt that no matter what the outcome will be, that this is the best thing for me at this point in time.
Well, my wife read your book that you gave to us. I have not yet read it. She absolutely loved it. And she told me that your story is extraordinary, and she started sharing tidbits with me. You know that I've been preoccupied with some very important things of late, so it's been hard for me to get around to reading it just yet, but God willing, of course I will. The title of the book again is?
So it's called Metamorphosis. It's my autobiography. The truth is, it was written as a letter to my children. I have 8 children, Baruch Hashem, and I thought I was dying 2 years ago because the cancer that I had is 100% lethal. There's only around 10 cases a year, and they're always found at autopsy, basically. And so in my particular case, it was found incidentally, but nevertheless, that the prognosis was grim. So I wrote a letter to my young children that they should know who their father was, basically. And then later it became obvious that at least God didn't want to see me yet. So I showed the letter to a few people, and they told me I should make it into a book because it carries a lot of uh, power, I would say.
Well, the equanimity with which you're speaking is, it's kind of I mean, the word shocking doesn't do it justice. It's unbelievable. You're about to undergo open heart surgery. You have battled cancer, what we religious Jews call Yener Machala, that disease, because it's so horrible, we don't even want to refer to it. Maybe we should start calling coronavirus as well Yener Machala. But you're about to do that, and the equanimity with which you approach it, and I have to say, it's not just admirable, but it's just astonishing. Which brings me to sorry.
I've learned over the years not to worry about things I can't control, which is almost most things. I mean, the only things I could control is basically how I think and how I speak and how I act. So the truth is, it really doesn't matter how a person dies. It more matters how they live. And so that's what I try to worry about. How long I'm going to live and all these things are not my department. I mean, I'm willing to do everything that I need to do. Open heart surgery, chemotherapy, radiation. It's not like I'm not going to do my part, but nevertheless, the outcome and the verdict, so to speak, how long I'm going to be, is not in my control. So that's why I really learned to let go of those things and make peace with the mystery of life.
I know that your surgery is going to be successful, God willing, and I know that you're going to be fine. And I'm asking you now, when that happens, and Zev Ben Leah is your Hebrew name, Zev, the son of Leah, and we were all, I was putting it all over my social media lesson that people have to daven for
Thank you.
I'm asking you now that when you, God willing, emerge whole and you heal fully, that you share with the world how your faith in God gives you the strength and the courage to persevere with such level-headedness, because it's really a gift. Because what I see right now, because you're not known for the person who is battling against cancer. This is a new thing for people who have followed you in the news over the past few months. You're known as the doctor who was promoted a certain regimen to treat the coronavirus. So this is like a new dimension of your public persona that we're discovering tonight. And we pray for your speedy recovery. But your faith, you and I were speaking over the past 2 days about someone who's very close to me who has the coronavirus, who's very sick with the coronavirus. And again, I saw the same thing, the calm, the positivity, the inspirational nature of your doctoring. I have to say, as we Jews say from the Talmud, words that emanate from the heart penetrate the heart. I have to say to you from the heart that you've moved me deeply and you've touched me deeply. I've been amazed at how caring a physician you are, and how your strength and courage transmits to your patients. It's quite an extraordinary thing to witness. And I see it now with you. You are your own patient right now. And so you have to give the rest of us direction when you come out of the hospital about how we can live with greater faith and live with greater joy and live with greater acceptance. Because what I see right now is paranoia, fear, distress. Our country, the world, but our country, the United States, is in the grips of tremendous paranoia and fear over the coronavirus. Now, so let's talk about the coronavirus now. Is that fear justified?
No. I'm going to speak directly to the American people and to the people of the world, that I have some very good and optimistic news for you, which is the following: that there is an effective, cost-effective, safe, oral approach that, if done properly, which I can explain to you what that means, converts COVID-19 to a similar type of infection as influenza. In other words, it's not a good infection, but it's manageable, it's treatable. We don't need to close down the economy. We don't need to have unnecessary death. So with your permission, I would like to explain to you what I've discovered. I'm a primary care doctor for a community of 35,000 people in upstate New York, and they live within a square mile. And when the COVID-19 virus hit that community, it hit it with a severe number of of patients, almost everyone getting sick at the same time. So my office was inundated by, instead of seeing 40 patients a day, we were seeing 250 patients a day. And it became very obvious to me that the world didn't know what they were doing. For example, the whole emphasis on treatment of COVID-19 was to build more respirators. Essentially, what we were telling patients is they would come to the doctor's office. We would say, okay, you have the coronavirus probably. Go home, take some Tylenol, drink fluids, and when you get into respiratory distress, go to the hospital, we'll intubate you, and then there's a 90% chance you're going to die. And so that didn't make sense to me. So nothing was being thought of or suggested to treat patients in the outpatient setting to mitigate the course of the disease, to improve the outcomes. You know, I have a solution for the respirator crisis. Don't get on the respirator. So what I started to do, I started to do research, and I looked around the world, what was being done. I looked into what South Korea did, which was use hydroxychloroquine and zinc. I looked into France, Marseille, France. Dr. Didier Roule was doing research with hydroxychloroquine and azithromycin. And what I decided to do was combine the different regimens, the different approaches from those countries. And I came up with a 3-drug approach. I modified the dosing to reflect less acutely ill patients. And I started intervening with my patients immediately upon presentation. In other words, I didn't wait for the results of the testing. If the patient seemed to have COVID-19, I would do the testing, but I would initiate treatment immediately and not wait, because the testing took 3 days to get back. So I'll give you an analogy. Imagine you have a fire in your kitchen and you call the fire department and they say to you, I'm going to come in 3 days. That's exactly what we were doing to patients. Did it make sense? Nowhere else in medicine do we ever, we're not going to treat your cancer until it's metastatic, or we're not going to treat your infection in your toe until you're half dead and septic. Except when it came to COVID-19, that's exactly what we were doing. Did it make sense? So I started intervening, and I slowly developed what is now known actually as the Zelenko Protocol, which is the following.
Which has become very famous as well as controversial. We'll talk about both aspects, but you've become world-renowned as so many fans and some critics debate Zelenko Protocol. But let's hear what it is. And let me just say that before we even get into any kind of controversy, I want to say that I've been amazed at watching you speak to someone who's very close to me with COVID-19 and your approach, which is filled with compassion and filled with inspiration and patience. And you understand that this disease and illness, well, of course, it has to be battled with all the right medications and science-based, et cetera. But it also has to be, we have to give people hope, and we have to give them strength. We have to give them the knowledge that there is hope. It's critical. So I witnessed that with my own eyes, and I wanted to say that before you get into this Zelenko Protocol. But let's talk about it. Yes.
So I published, I saw 2,200 patients in my team with COVID-19 in the outpatient setting over 4 months. 2,200 patients, probably more than anyone else in the country, if not the world. And my outcomes are the following, and it's all documented in a paper that I published, that we had 2 patients die out of 2,200. One of those patients had advanced leukemia, and the other one was elderly, and when he presented was already very, very sick. And I had 4 patients end up on a respirator. Now, let me give you the approach. I didn't treat everyone. I risk stratified patients. In other words, patients that I considered high risk, which I define as if you go to the hospital and you see who's dying, which patients are dying, which patients on the respirator, you'll find out very quickly it's patients over the age of 60 or patients younger, but they have medical problems, diabetes, high blood pressure, heart disease, and so on, immunosuppression, like, cancer. So these are the patients that were getting complications from COVID-19, but everyone else was recovering on their own. So out of those 2,200 patients, I actually only treated, quote unquote, with medication, 800 of them. In other words, the rest, which I considered low risk, were given supportive care, meaning go home, have some Tylenol, drink some fluids, and if something doesn't, if things don't go well, give me a call, follow up. And out of those patients, out of the remainder of, was it 1,400 patients, 100% of them survived with no hospitalizations. Now, the 800 high-risk patients over the age of 60 or under the age of 60 with medical problems, I treated with medication within the first 5 days of the onset of symptoms. And that's extremely important, and I'll explain to you why. If you look at the viral load dynamics, in other words, how much virus is in the patient, the first 5 days of the onset of symptoms, it's essentially flat. It doesn't really change. But around day 6, it explodes like a wildfire. Now think about it. Most people don't go to the doctor right away. Someone gets sick, they wait 2 days usually. Then they realize, wow, it's not getting better. So they call the doctor, day 3. Then you don't get the appointment usually the same day. So you come to the doctor between day 4 and 5. So I was seeing patients on average between day 4 and 5 of COVID-19. And the testing took 3 days to get back. That would bring them into day 8. By then, they're really sick. So what I decided to do is if I suspected that the patient had COVID-19, I would treat them on clinical grounds. I wouldn't wait for the results of a test to make a decision. In other words, if I thought about it, I treated. And so that's the second part. In other words, risk stratify the patients. In other words, cherry pick the high-risk patients. Initiate treatment as soon as possible. And then I used a 3-drug regimen. Here it is: zinc, hydroxychloroquine, and azithromycin. And let me explain to you how it works. It's very important. You have an intelligent audience. So the virus is inside the cell. Viruses, by definition, need to hijack the cell's machinery to reproduce. So a virus gets inside the human cell. And there's an enzyme in the cell which helps the virus replicate. It's called RNA-dependent RNA polymerase, or replicase. That's important because it turns out that zinc kills that enzyme. In other words, it inhibits viral replication. But there's a big problem with zinc. Zinc does not get into the cell because, if you know biochemistry, zinc is dissolved in solution in the plasma. It's a positive ion, and the cell membrane is lipophilic, which basically means it's like cholesterol. In other words, oil and water. So they don't mix. So the zinc cannot get into the cell. So that doesn't help you. So what does hydroxychloroquine do? All it does in this particular instance is open up, it's called a zinc ionophore. It opens up a channel that allows for the zinc to go from outside the cell to inside the cell. Very simple, very elegant. That's all it does. It's a gun and a bullet analogy. In other words, a gun without a bullet and a bullet without a gun are completely useless. It's the combination, the synergy of the two that makes it effective. So zinc needs to get to the place where the virus is. The hydroxychloroquine delivers the zinc into the cell. Now the azithromycin, or I sometimes use doxycycline, which is an antibiotic, what they most likely do is prevent secondary bacterial pneumonias, which are very common with people with COVID-19. So in other words, here's the concept. Get the virus killer inside the cell and protect the patient from developing complications by giving them antibiotics. And that's it. So listen, this is what happened. I had, out of those 800 high-risk patients, you would have expected a 10% mortality rate. That's 80 dead people. I had 2 dead people. You would have expected a multiple of that on ventilators, at least 100. I had 4. So I realized, I'll give you, in other words, I wasn't doing research. I was looking for a solution to keep people alive. And I'll give you an analogy. I felt like a frontline soldier who stumbled across some very important intelligence. And I needed to communicate this intelligence to the 5-star general in order that he has the information to win the war. So I realized the implication of what I found. So I don't have connections. So I decided to make a YouTube video, and I didn't even know how to do that. I had to use my 17-year-old son he's a millennial, to actually help me. And I made a video and I appealed to the President of the United States. And I said, Mr. President, I have something very important to tell you, and please contact me. The next day, Mark Meadows, the president, at that time he was the incoming chief of staff, calls me on my cell phone. And he says, I I saw your video, how can I help you? So I told him what I was seeing, and he said he's very interested, and just to keep him updated. And this was early in the process, so I didn't have that many patients to report. And then subsequently, Rudy Giuliani reached out to me, and I ended up doing a few podcasts with him. And the first podcast was seen by, I think, 800,000 people. And since then, um, I had I'm advising currently 7 countries on their COVID-19 response. For example, the entire country of Honduras is following the Zelenko Protocol. Bolsonaro, the president of Brazil, is a big fan of my social media, and he just recently got COVID-19. He took the protocol, and he's doing great. And large sections of Brazil are now coming on board.
President Bolsonaro took the Zelenko Protocol when he got COVID-19.
Correct.
So let's just go back for a second. I want to get, because the politics is going to muddy the waters just a little bit, because hydroxychloroquine has become so deeply politicized for reasons that I can't quite fathom.
Well, I can clarify that.
Well, you and I have talked about it, but let's not jump the gun, because people have not been privy to our conversations. So first of all, what you've said until now makes a lot of sense to me, because I've seen people get very sick with COVID-19, and I've seen that they have become unnecessarily sick, meaning I'm not a doctor, and I know my limitations. I'm not a doctor. But I also know that when people that I knew first thought they had symptoms and went to a primary care physician or an emergency room, and even if they were told by a doctor, I think that you have COVID-19, here, let's do a test. And now, of course, the test, you don't get an answer for 4 or 5 days. And I've seen that what you're saying is correct. What a tragedy. They're getting unnecessarily sick because they're not being given anything. Without the Zelenko Protocol, if someone goes to an emergency room and they say, look, we think you have COVID-19, here's it, take a test, you take a test. Now we have to wait 3 or 4 days to see if you're positive or negative. What do they give them then? Nothing?
Nothing.
Nothing. Zero. Nothing.
Right.
So we're just creating a situation where high-risk patients can get extremely sick, God forbid, and be forced to fight for their lives, which is preventable. That's what you're saying, right? That's a really serious thing.
My data shows the following. If you follow my protocol, my data showed an 84% reduction in hospitalization. Let me explain to you what that means. Out of 100,000 admissions in the hospital, we could have prevented 84,000 of them with a drug, by the way, which is safe and costs $20 and is oral by mouth. Do you understand the implications of what I'm saying to you? Let me clarify it if you don't.
I understand the implications.
Scale this
directly impacting.
If you scale this approach, no, here's the implications though. If you scale this approach nationally or globally, that's the end of the pandemic. My survival rate in patients, my death rate in patients, high-risk patients, was 0.7%. In other words, 99.3% survived. You would have expected 10% to die. So instead of 10% of dying, I had 0.7% dying. Do you understand what that's implication? A death rate, a reduction of more than 90%.
Because you're using a protocol which is preemptive in nature. You're trying to help people before it gets really.
Exactly.
Listen, I'm not at liberty to quote some very significant medical names with whom I've discussed your protocol because I don't have their permission. I wish you and I organized this this discussion very quickly, Zeb, because you weren't feeling well and you had your surgery, so we decided to move it forward, which was a good decision because what you're saying is so important. I want people to hear it. But I didn't have the opportunity to go to a very significant medical name and ask for his permission to quote him on what he's told me. But he kind of agrees with you fully that the idea that we're giving people absolutely nothing when they show the symptoms of coronavirus, if they are high risk, means that we're putting their lives at risk unnecessarily. And that really is a tragedy. And there's someone very close to me who went through that, and your protocol, I'm sure would have been very helpful. And that's what so upsets me, that you go to an emergency room and you have these symptoms and you're high risk and they just send you home, which is the dumbest thing without giving you, I mean, it makes no sense because this could be a killer disease and it is a killer disease. I mean, I say can be because it, like you said, it affects high risk patients much more. It is a killer disease. It's killed 150,000. It's killed 150,000 Americans. It's killed hundreds of thousands more around the world. And I want to know what we can do to save their lives. That's what I want to know.
I have my neighbor here in the hospital room.
So Zev, so the Zelenko Protocol. So what you explained to us thus far, before we get into Bolsonaro or President Trump or any of the political figures, zinc can stop the virus from replicating. Is that correct? If it gets into the cells?
Correct.
Okay. But you need hydroxychloroquine to get the zinc into the cells.
Correct.
So I asked this world famous, you've now become world famous as well, but I asked this world famous medical authority and I said, why is hydroxychloroquine so incredibly controversial? Why are they saying it give you heart arrhythmias, et cetera? So he said to me, well, I really don't know. He said to me that and I'm not a doctor, but he said hydroxychloroquine has been a malaria drug for 70 odd years, and it was seen as a safe drug. And he told me that in many countries in the third world, it's even sold over the counter. Is that correct?
That is correct, yes.
So has it become just completely politicized? I mean, because hydroxychloroquine is dividing the country almost as deeply as masks are. And why? Why is that?
So hydroxychloroquine has been around for 65 years. It's given to pregnant women. It's given to nursing mothers. It's given to children. It's used for the treatment of rheumatoid arthritis, lupus, malaria, and malaria prophylaxis. It's currently being used by millions of people. I asked there are 3,000 electrophysiologists in America. Electrophysiologists are cardiologists that deal with rhythm issues of the heart. And that was the whole concern with hydroxychloroquine, that there's a theoretical risk that it may cause arrhythmias. So they have their own like WhatsApp group. So someone I know, a friend of mine, he asked the question, has anyone seen any hydroxychloroquine related deaths? And the answer was 0, caveat, in the outpatient setting. They were in the ICU, intensive care unit. But that's fine. I mean, I wasn't advocating for its use in the ICU. If my patient is in the intensive care unit, I didn't do my job. So, but there were 0 in the setting that I was recommending. All this fear mongering, we're up to almost 150,000 dead Americans. So the hypocrisy, the stupidity, you ask anyone who's fear-mongering, ask them just simple numbers. What percentage what are the stats that you're referring, that you're puppeting information that you didn't even know? So you have to ask yourself, why are they doing it?
Right. Hydroxychloroquine, I have no dog in this fight. I have no dog in this fight. I couldn't, before someone who I'm very close to, I mean, I've seen so many people get sick with COVID-19, but someone I'm very close to got sick, and it changes your perspective completely, because then you begin to wonder, God Almighty, was this preventable? And your entire protocol is preventive in nature. It's prophylactic, essentially, correct? To make sure that we don't get very sick with COVID-19. So how has this become so politicized? How has a drug that has been considered safe for 65 years, how has it become a drug that is dividing America? And if it's not being administered, it could be it could save many lives. You're saying it could save so many lives.
There's 4 reasons. Politics, money, arrogance, and fear. Let me explain. The President of the United States, Donald Trump, it's a matter of public record, made an announcement that he believes hydroxychloroquine is part of the solution in this pandemic. He actually happens to be right. Now, this has nothing to do with my political views. It's just a political analysis. Now, we're a few months away from probably one of the most crucial presidential elections in the history of this country, or at least in my lifetime. And half of the country does not want the president to win, which is fine. We're in a democracy. Let's have our debates and go and vote. But what's happened is, since the president came out in support of hydroxychloroquine, And if it turns out, which it is part of the solution, that is a huge political win for the president right before a crucial election. So there are forces in this country who literally would prefer to see the economy burn and a percentage of the population to die rather than to give the president a win right before an election. That's number one. That's my political analysis. Number two, the big pharmaceutical companies, like Gilead Pharmaceuticals, for example, um, makes a drug called remdesivir. Remdesivir has been shown to reduce hospitalizations by 1/3. In other words, and that was the basis of its emergency use authorization, that on average, patients were in the hospital for 15 days. If they received remdesivir, the number of days they were in the hospital was 10. So, okay, that's significant. A reduction in hospitalization by 1/3. Great. However, my approach reduces the need for hospitalization by 84%. In other words, each dose or each treatment course of remdesivir is $3,200 and it's IV. So if you reduce, my approach basically reduces remdesivir's market share, Gilead's market share, by 84%. We're talking about $1 trillion. So you don't think people who have a financial conflict of interest are going to try to preserve their profit margin?
But let me just be clear. You don't have any issue with remdesivir, and you accept the clinical studies that show that it reduces a hospital stay by 1/3, 15 days to 10 days.
Absolutely. If my patient,
Very significant. You're just saying that remdesivir should be used when people get very sick, and you endorse its use.
correct.
You're saying let's try to stop that from ever happening in the first place, correct?
I mean, that's obvious. In other words, there's 3 stages to this disease. There's the stage 1, where the patient is in the primary care doctor's office. Stage 2, when they're in the hospital. Stage 3 is when they're half dead on a respirator. I'm recommending treat patients in stage 1 and prevent them from going to the hospital. If for some reason they end up in the hospital, then use remdesivir, sure. But
Okay, wait, but of the 3 parts of the Zelenko Protocol, I understand 2. I mean, to the best of my ability. Hydroxychloroquine is like this, as you say, it's like a gun that fires this bullet into the cells. The bullet is zinc, and zinc helps to stop the propagation of the virus as it enters the cells. Is that correct? And what is the 3rd part of the protocol?
it's a bulletproof vest for the patient that prevents the patient from developing pneumonias.
Okay, and what's that called?
Z-Pak, azithromycin.
Okay, and that's an antibiotic.
Correct.
Okay.
There are others also. You can use doxycycline, whatever. But the idea is to reduce the risk of developing bacterial pneumonia.
Okay. I don't understand why your protocol is at all controversial. I actually think it's laudable. So people are going to say, well, Shmuley, you're not a doctor. You don't have the knowledge. My response is, I've discussed this with competent doctors, many of whom are treating COVID-19 patients in a large scale. I'm amazed at how behind the scenes people praise you. One world-renowned physician told me that your quote, that he said to me, Zelenko is a force for good throughout America. Another one who deals with a lot of COVID-19 patients, not world famous, but an extremely competent doctor, said to me that I actually believe in the Zelenko Protocol, and I've been prescribing it myself. Why are people telling me this only quietly? Why are they saying it under their breath? So you're telling me that there's political reasons to repudiate or to discredit your protocol because you're saying it could give President Trump a victory. Okay, that's very possible that there's politics and money involved. Money, I'm sure, big pharma, et cetera. But most of the physicians that I'm talking about are actually good people. They're reputable. They may have their own political convictions. Everybody does. But I don't think that they would politicize this illness. They seem to be a little bit scared about embracing, Zev, your protocol. Why? Do they feel that you're seen as too close to the White House? Do they think that you're seen as President Trump gave, I think it was a news conference, and he said that a very nice man wrote to me from, I think he said Westchester, about taking hydroxychloroquine. He then announced that he's taking hydroxychloroquine, and that nice person was you. Is that correct?
Yes.
Yes, that was
he announced that he was taking hydroxychloroquine and zinc, and he said that he received a letter from a doctor somewhere about Westchester or around there somewhere, and telling him, Mr. President, I'm seeing really good results with this. Please, I just want you to know. And then he said he didn't even want to have dinner with me. He just didn't want anything. He just wanted to let me know. Um,
Yeah.
so
So
yeah,
that.
but that's not why. Doctors are afraid.
But okay. Sorry. Yeah. Go ahead. Yes.
There's a fear element because there are state regulations now in New York and Nevada, Michigan, and there's a few other states where doctors are being sanctioned for using these medications. They're being vilified. Their credentials, their livelihoods are being put at risk.
If they prescribe the zinc and the
Not the zinc, the hydroxychloroquine. Yeah.
hydroxychloroquine. Okay.
It's, in other words, it used to be that the doctor-patient relationship was sacred. Let's say you're my patient. You come to me. I tell you, listen, Shmuley, I think you would benefit from hydroxychloroquine. You would think about it and say, okay, I agree. And I would give you the prescription. You would go to the pharmacy and take it. Now the government comes and says, no, we know better. We're going to intervene. So what's really happened is that the government has intruded into that which is sacred, the doctor-patient relationship. This is really the definition of tyranny.
Okay.
So physicians are afraid.
Good.
Physicians are afraid to use these medications because of their professional liability associated with that. They're afraid to be sued. They're afraid to lose their license.
Interesting. Okay. So therefore, when I raise your name with doctors with whom I'm friendly or acquainted, some of whom are of world renown and some of whom are just extremely competent professionals who are treating COVID-19 patients, they have all, one by one, they all kind of, some praise you, some don't go as far as praising you, but they endorse you. Only one so far has really criticized you to me. And that, he said, was based on something completely different. Okay, so I've seen the controversy, but part of it also is that you started to mention President Jair Bolsonaro of Brazil and President Donald Trump of the United States of America, our president. These leaders are seen by some, and I don't want to politicize even our conversation. I really want to get to the truth because I care about saving lives. I truly do. And I know you do. And that's why I respect you so much. I've seen it. I'm a firsthand witness to how much you care about saving lives. And I'm grateful because it's someone that I'm very close to, who you've tried to be very helpful to. And I'm very grateful. The problem is that these leaders are seen by the public. Many in the public see them as having been, let's say, callous about the COVID-19 crisis, that they didn't lock down their countries enough, or they gave conflicting advice. So for example, President Trump has his supporters, he has his detractors. His supporters say he identified the threat early and shut down international travel from China, Europe, etc. His detractors say, what a mess. The United States is, I think, 8th in the world in the mortality rate. This became a debate between Chris Wallace and the president in the Fox News Sunday interview this past Sunday. But I looked it up myself. I saw the Johns Hopkins things, and we are with Iran and Pakistan and countries like that, the mortality rate. So the president has detractors. I'm not agreeing with them. This is a president that I happen to have a lot of personal gratitude to for his phenomenal support of the Jewish people and the state of Israel through a time of rampant, absolutely vile, disgusting anti-Semitism, which is rearing its head throughout the world. But looking at the coronavirus, when you start quoting how Bolsonaro himself is taking the Zelenko Protocol, and he seems to be okay, thank God. But other people are saying, but Bolsonaro was callous about Brazil, and they have runaway mortality and runaway infections. And the United States can't get this under control. And we thought that it was going to kind of be under control. So when you become associated with political leaders whose response to the coronavirus, justified or unjustified, is controversial, does that also make you controversial?
COVID-19 kills Republicans and Democrats equally. It's irrelevant to me, politics. It's not what I'm focusing on. I'm focusing on the sanctity of human life. Every human being is made in the image of God. They have a spark of divinity in them. Their soul is precious, and it's the basis of natural law and human rights. So as such, my focus is preserving all life as much as possible, um, mitigating complications and suffering and misery. So it has nothing to do with politics. So how people perceive it, I don't know, but that's irrelevant to me.
Are
And
you the one, are you the one who made hydroxychloroquine so incredibly famous, especially in the United States? Are you the one who promoted it more than any other? Because like before COVID-19, I had never heard of hydroxychloroquine, I don't think. Now I hear about it everywhere. Are
I was
you?
using it 10 days before the president mentioned it, and I've been the most vocal proponent of using hydroxychloroquine and zinc. I'm going to keep on using the zinc because people forget, and the azithromycin, because um, I saw it work in the field. I saw it work. I was basically 6 months ahead of everyone else, because if you notice, all the studies that were being done, they were being done on the ICU patients, on the sickest of the sickest patients. No one was focusing, and actually, even still, no one's focusing on developing treatment strategies in the outpatient setting. By the way, I'm not saying my treatment is the best. All I'm saying is my treatment is the only treatment right now.
Right. No, I even someone who isn't a doctor. See, I want to be very careful in this conversation. I want to speak to issues where I have credibility. And on medical issues, I'm not a doctor. I don't have a lot of credibility. I'm fully aware of that. You have tremendous credibility because, as you said, you've treated 2,200 patients who had COVID-19. Again, I want to emphasize that I'm speaking from a firsthand witness to how you deal with patients who are ill with COVID-19. But I'm also shocked that there is nothing to help those who develop symptoms who are in high-risk categories who should have been helped before they got sick. That shocks me. I mean, that is just shocking. So how do your critics respond to that? Like what you just said was very humble. You said, well, I'm not saying that mine is the best protocol. Mine is the only protocol. Why aren't there at least even others? And why aren't there others? How is that possible?
So let me tell you how deep this goes. In the beginning of this year, the New England Journal published a study that concluded the following: that only clinical trial data, in other words, data that's derived through clinical trials, is considered valid, and real world evidence is considered anecdotal and is not valid. So basically what happened, that who runs clinical trials? Essentially, it's big institutions, it's the Fauci types, and they're being supported by companies like Gilead. For example, there was a Lancet study which was published that showed that hydroxychloroquine is ineffective and maybe even kills people. And the WHO, the World Health Organization, used that study as a basis to come out with a global recommendation against the use of hydroxychloroquine. Subsequently, this study was found to be fraud. It was fraudulent and had to be retracted. And if you look at the top right corner of that study, it says sponsored by Gilead Pharmaceuticals. So all of a sudden, what's happened is that there is a monopoly about who claims to have truth. It's the small, narrow people that run clinical trials who have established themselves as the priests of truth. However, what really has happened, they've become corrupted. The medical peer review research process is diseased. It's not about truth anymore. It's about expressing a specific narrative. So let me ask you a question. Do I need a clinical trial to know that parachutes are a good thing when you jump out of a plane? Should I randomize it and send 10 people out of the plane without a parachute and see what happens? Or it's obvious that you need a parachute and I don't need to do that? Or I'll give you another example. What if I'm drowning in the ocean and all of a sudden I see a piece of driftwood? I don't have a clinical trial that's going to say that it's going to save me, but I have nothing else. So you don't think I'm going to hold on to it? I may get a splinter, but at least I won't die. I'll give you another example. Imagine Washington, D.C. is being carpet bombed. And would it make sense for Dr. Fauci to say, well, we need to do a clinical trial to see which bullets are the best? And it may take 3-4 months. And then once we figure out, we're going to use them. Or would it make sense to use the best available bullets at this point in time to shoot down the planes, do research in parallel, and if you develop something better, transition to the use of that? Wouldn't that make sense? So why is it that you have a cheap, safe, effective option to treat COVID-19 in the outpatient setting with an 84% reduction in hospitalization and a survival rate in high-risk patients of 99.3%, what you would expect a 10% mortality? Why is it not being implemented while we do the research? So that's where the arrogance comes in. It's
You said politics, money. That's where the arrogance comes in. And there was one more reason. You said
fear. Physicians are afraid.
They're afraid of being sued.
Losing their credentials. It's hard to become a doctor. It takes a minimum of 11 years.
I'm very, very upset as an American, as a person.
But, you know what? Let me
let
me not mince words.
No, I'm actually very upset that because I've seen people who had early symptoms who then got very sick when they really, I just know, I mean, I'm not a doctor, but I just know that something should have been done to try to prevent the spread of the disease before they got very sick. Like you said, the way we in the New York metropolitan area where I live dealt with we were hit with this tsunami of infections in March, April. Now, thank God it's getting better. You're correct. The way we dealt with it was to run around the country and get as many ventilators as possible. And, that was very important. I'm not knocking it at all. I was very impressed how much we value life and get the ventilators, et cetera. But no one said, let's first and foremost ensure that we don't get people on ventilators. Well, now that's not really true. Let me be fair. They did say, let's social distance. Let's make sure that we don't, we have to be apart now so we can be together later. And I'm in favor of that where it's necessary. And to be honest, because we don't have a lot of time tonight, we can't really debate the merit of the lockdowns, whether schools should reopen, et cetera. These are all very critical issues, and I'd like to do a part 2 where we can talk about that. How severe should the lockdowns be in the quarantines, and should the schools reopen? And I know that you're very opinionated on that, and that's very important. But that's a whole separate discussion. The only preventative measures that we were told to enforce, let's say here in New York, where we were really hit by it, was, of course, separation and quarantine and lockdowns. I get it. But those who did get the virus, they weren't given any, if they were high risk, they weren't given any protocol to take, right? That could have maybe stopped them from getting very sick, and we could have saved their lives. That bothers me tremendously.
We are witnessing and living through, because we don't have yet the perspective of history, but this could be considered crimes against humanity, mass murder, and perhaps even genocide. Genocide against the vulnerable.
Well, Zev, I first of all, I have deep respect for you, and I'm amazed that you're even doing this discussion on the hospital. I personally have to disagree with the word genocide, only because I'm very involved in genocide memory and genocide prevention. And genocide presupposes that there's an enemy who's going to slaughter an ethnicity and try to eradicate an ethnicity. Like you said before, COVID-19, first of all, COVID-19 is blind. It's a pathogen, but you said it has no borders. It's not trying to attack Black or white or Protestant or Irish or American.
Jewish. It attacks the most vulnerable. In
Correct.
New York State.
Correct. It goes after the most vulnerable. And in that sense, it's almost like a Molech, if you want to use biblical references. But again, there is conscious, willful choice on the part in genocide, on the part of some evil perpetrator or murderer that's going to kill a victim. We don't have to call it genocide to still speak about how awful.
There was a 50% death rate in nursing homes in New York.
Well, that was an insane decision on the part of governors to put COVID-19 patients into
a willful decision.
Right. Okay. But I don't think they did it because they wanted to kill people. God forbid. I'm not going to accuse them of that. I think what they did was, I don't know what words to use. Irresponsible. That's not strong enough. Murder. That's too strong. I feel there's something.
Manslaughter.
I'm sorry.
Manslaughter.
Could be. Listen, I have a very good friend whose mother died in a nursing home. She was perfectly healthy. I saw her a month before she died, and she got COVID-19 when they brought COVID-19 patients to her nursing home, and she died. And this is someone who's liberal and more left-leaning, and they're shocked and outraged to their core that a Democratic governor did this. So it's not about politics. I agree with you. Listen, Zev, if I didn't feel that what you're saying and what you're doing is critical and important. And if I didn't feel that you could really be which you are, thank God, an enormous force for saving lives, I wouldn't be discussing this with you, and I wouldn't be asking you to have this discussion 2 nights before you have open heart surgery.
Shmuley, do you know how much bloodshed I saw? Do you know how much suffering and unnecessary death that I saw? The misery, I had listen to this. I had a patient from actually Montreal, calls me up, a pregnant woman, late 20s. She's like 7 months pregnant. She has COVID. She asks me if she could take the protocol. I said, absolutely. She goes to her doctor. The doctor refuses to give it to her. 2 days later, she has 2 major strokes, has a pulmonary infarct, loses her baby, and is still on the ventilator 2 months later.
That's a truly tragic story. And as you said, preventable.
And you can scale that by 1,000 at least.
How is she?
She's on a ventilator. She's brain dead. So.
To even hear this is too painful, because I also, I'm not a doctor. I've said that repeatedly, but as a rabbi, I've been consulted on countless occasions about COVID-19 tragedies. And honestly, sometimes the grief is so overwhelming that one becomes punch drunk. You become almost senseless.
Let me tell you, there's some other pandemics going on. A pandemic of suicide right now. There's diseases of despair. A pandemic of child abuse. I speak to emergency room doctors. They're seeing an incredible amount of child abuse, spousal abuse. There are people dying from collateral.
Happening because of the paranoia, or because of the fear, because of the...
Well, these are diseases of despair.
COVID-19 is real. Your one message tonight is COVID-19 is real. It's a killer, but it's preventable. There's so much that can be prevented.
Let me make it very simple.
Your message. I don't want people to misconstrue your message that this isn't a killer disease, that we should grow complacent about it, because we dare not grow complacent about it. What you're saying is that there should be a protocol in place that when people first show symptoms, or if they think they have it, where high-risk patients can take your protocol, the Zelenko Protocol, and we can, God willing, stop them from getting very sick and having to go on to a ventilator, which has been the strategy until now. Have enough ventilators, correct? Have I summed that up correctly?
Let me make it very simple. When COVID-19 is in the sinuses and in the nose, it is extremely easy to eradicate. The second it goes down into the lungs, that's when the blood clots happen. That's where the catastrophic lung injury happens. That's when people get very sick. The key is get rid of it when it's here and don't let it go here.
Well, for that, we need more testing, and we need tests that we don't have to wait 3-4 days for.
No, you don't need testing. All you need is a brain. You need clinical sense. It's so easy to diagnose.
What do you do? We're running out of time. Let me ask you. So, okay, you said you need a brain and you need sense. Tell us practically speaking. People are watching right now. They might have sniffles. They might start feeling like some of the symptoms they've read about.
Let me give you the symptoms. It's very simple. It's flu-like, high fever, cough. Here's something very important: loss of smell and taste. Very few other things actually cause that. You can have diarrhea, you can have back aches, and so on. Now, it's not flu season, right? If you come down with this, you don't have to be a rocket scientist to realize that you probably have COVID. If you want, go to the doctor, let them do a flu test. The flu test is going to be negative. So then what do you have? Let's say you were exposed to COVID. I mean, it's just common sense. And by the way, you could always stop treatment, right? Do the test.
And you're saying of all the symptoms, you think that loss of smell and taste is the most significant because almost nothing else is associated with that?
It's pathognomonic. That's what it means. It's essentially that's diagnostic of COVID.
Okay. Listen, Zev, we've kind of run out of time. We've actually gone beyond the time, but what you're saying is so important. I want people to hear it. First of all, let me tell you from the heart, I want to thank you personally for the assistance you've rendered to me in helping deal with someone who's unwell, who's close to me. I'm very grateful. Secondly, I want to thank you for all the lives that you've saved and how you've put yourself at risk, because you yourself, as you said, you lost a lung, correct, due to cancer, and you were still treating 2,200 COVID-19 patients. So thank you for all the lives that you saved.
My team, yeah.
Third, your team. Third, thank you for your friendship, your incredible faith in God, how you wear your faith on your sleeve, which I champion, salute, admire, and respect. And thank you also for fighting the fight to ensure that there's a protocol at early stages to save lives before people get very sick. I don't have to be a physician to know that there has to be a protocol. And I think it's amazing to me that your critics let them at least come up with what the alternative is. But I want to thank you for highlighting how serious this has become, that we're not trying to stop the disease in its earliest stages. And I've seen too many people suffer and people die, and I'm just kind of in shock. Now, my father, who died 2 months ago, he did not die of COVID-19. He didn't have the coronavirus. He might as well have died of COVID-19 because it was our inability to really visit him in the hospital once they locked down the hospitals after he had had a catastrophic stroke a few months before that made us decide that, we couldn't really keep him in the hospital any longer. We were trying to do everything we could to get him out. If we could have continued to visit him and be with him and sing to him and hold his hand, things might have turned out very differently. But the lockdowns we began to feel like he's just being warehoused, and bed sores and mouth sores and all these horrible things, and his children can't even be around him. So I have seen,
collateral damage.
Yes, the collateral damage. I mean, I'm saying Kaddish for my father. You and your son were part of my minyan. And
I want to end, Rabbi Shmuley. First of all, your father's neshama should have an aliyah, and
thank you.
He has a lot of schusim.
Thank
but
you.
I want to say again, I'm going to speak directly to the American people and to the President of the United States. American people, we have hope. There is light here. There's a cheap, affordable, very effective, and safe approach that could really convert COVID-19 into a manageable infection. And Mr. President, you are about to there's going to be an election. You need to reassure and reduce the anxiety of the American people by instilling hope. You can reopen the economy, and we can manage this infection effectively.
Well, Zev, God willing, when you emerge healthy and strong from your surgery, and that will happen in the next few days, God willing, we're all praying for you, Zev and Leah, and I will personally be davening for you. I want to do a part 2 where we talk about your views on, should we be reopening? And I'm, although I live in New Jersey, I'm from Miami. My whole family still lives in Miami, and Miami has been hit, so hard. I'm shocked to see what's happening in Miami Beach, where my mother lives, my brother, my sisters, and my nephews and nieces. So I want to talk about all those things, and the schools, which is an extremely controversial issue. President Trump has said that he might even deny federal funding to schools that don't reopen. My dear friend, Dr. Oz, spoke about the schools reopening even, whatever it was, six weeks ago, maybe more, and he was absolutely vilified. I won't talk about that. But I want to save that for when you're better. We'll do that in the next few days. But let me conclude by saying that God be with you. You should get through this. I say this with all my heart. That God be with you, and you should be strong, and the surgery should be extremely successful, because humanity needs you, the Jewish people need you, the American people need you, your family needs you, I need you, and Hashem should watch you and keep you and bless you in every way.
Amen, Rabbi. Thank you. Thank you so much for the kind words.
And refuah shlema. God bless you, Dr. Zelenko. God bless you.
God bless you.